recognize the signs of stress and, of course, feeling exhausted, getting sick more often than usual, not getting enough sleep, feeling impatient, irritated, and forgetful. Not enjoying things you used to enjoy, and of course, this there is also because of all the burdens you carried out during palliative care support for this cancer patient, for this patient, not even cancer alone, even for mental. Um, of course, this is the way of managing stress, getting help, exploring yourself to provide care and help from others. And this can mean hiring people to care for the person with cancer or help to help those you in with those errands or childcare, making time for yourself and other relationships, spending time with what you love and what and continue and taking breaks that can help you continue being an active caregiver. And of course, exploring options for financial assistance, out of pocket, such as parking, transportation, and food can add up for a caregiver. And of course, cost may be hard. You can also seek financial counseling and, of course, find out if the center or the hospital where the person is with cancer is receiving treatment provides these services. Of course, being kind and patient with yourself. Um, and many caregivers experience or caution or burnouts of anger, frustration, and I imagine caring for cancer patients may not be easy. And try find out positive ways to cope with the fear. Of course, one of them is like journaling, talking about the issues and so on and so forth. And of course, exercising, eating healthy food, staying hydrated, sleeping enough. And of course, you can evaluate your own health. Stress of caregiving may lead people to develop increased health habits, unhealthy habits such as smoking and alcohol. Of course, when to seek professional help is when you are, let's say, you're in a crisis and they need to pay attention. There's a need for caregivers to pay close attention to the emotional and the mental health. Several studies have shown that are at an increase of depression and anxiety because they carried a lot of weight, especially when to clients, and they get to get into their shoes, and of course, during therapy, they live with their issues. That's why for professions who are for individuals who are about to get into the counseling profession, they are given therapy sessions to get to talk and address their own issues before they learn how to address their other people's issues. And having trouble to cope with the emotions, talk to a doctor or a counselor to help you keep yourself in check. And of course, keeping in mind that taking care of your emotional health and physical needs will make you more active. And of course, towards the end of this session, towards the end of the domain, you'll at least be able to explain the type of stressors to both patient and family, identify psychosocial issues throughout the trajectory, of course, list the role of counselors and mental health practitioners in the cancer journey, have an understanding on the role of community support cycle, and of course, you are able to identify care. And of course, during the grief and bereavement, grief is something I'm going to discuss towards the very end of cancer, and of course, loss of a loved one, item, body part, or a pet that can be lost, not only a person. Of course, there's the reaction towards grief, there's the emotional reaction, the feeling of that, the feeling that this person has gone and may not person has gone and no one will be there for them. There's the hopelessness, that there's no hope. There's a shock. There's the shock and the feeling that the loved one has gone will come as a shock to them, and they won't believe that their this intellectual reaction. They will forget disorganized irritability to focus once, and of course absent-mindedness. They won't concentrate a lot, and of course it's a spiritual aspect. God, let God let them die. They deserve this. Is it a punishment? Those are the questions that they ask. So there are types of grief, and of course, there's a reaction that one is disconnected to his or her feelings, of course, overtired. They feel sleep, they have a lot of sleep or less sleep, and they become more teary and less fatigue. Bereavement is a period of mourning and even the loss of loved ones. So loss is when that person may go and may not come back, and they ask themselves, what will happen to my own life moving forward? Will life be the same again for me? And of course, there's anticipatory grief. It's emotional response that is experienced before the true loss, and of course, it's the basis, the present state, which includes participatory grief or premature grief. And and the patient who has been sick for some time, the family begins to adjust to the possibilities of losing their loved one. This is the acute grief. It occurs after someone has lost a loved one, and the feeling maybe intense is the integrated grief. It's in the normalization process when a couple of months after they lost their loved one, so they, it's something that they come to realize that their loved one is had they buried their loved one months ago. And of course, during this time, they get to realize that, oh, that I've lost just been a year or a month since their loved one has passed away. And of course, during anticipatory, the person is there, is not yet dead, but they go through grief that this person is about to die and might not ever come back from what they are going through, because it's what they carried in their mind. And of course, complicated grief. It's necessitating lingering feeling of loss for a longer period of time. It's a complex and grief disorder. So, towards the end of cancer, I will want to go through this grief gradually, but for now, I just want to introduce you to grief, and at least I can say is that using complicated grief, it's the grief that takes depends with the person. There's those who will grieve to a point it goes to months, years, and towards 2 years, it becomes a psychiatric problem. That is why within the 6 month period, it is important that they seek counseling. And of course, factors of complicated grief. There'll be a lot of violence, unexpected. Um, they'll realize that the loss was unexpected. This is the child for emotional support. Not everybody has the knowledge or how to deal with the loss of a loved one. Grief has a history of mood and anxiety disorders, and not everybody knows how to deal with a loved one, especially those who have issues to do with mental illness disorder. and not knowing how to take care of them. And of course, there's the prolonged symptom of complicated grief. There's the feeling of emptiness that is without this person, I'm nothing, and there's no hope. Then there's the emotional pain and sadness, and of course, the yearning to be reunited with the deceased. This is where suicide now really comes in. The thought of suicide comes in, and then there's the preoccupation with the deceased or with the circumstances of death. And then uh, continue the avoidance of reminders of the disease. People not so much for the disease is the engaging the happy memories of the lost person. Of course, this reduced sense of identity, attachment of survival of friends and families, lack of desire to pursue personal interests or plan. And of course, grieving is a cultural process. It's okay to grieve. There's the healthy aspect, there's the unhealthy aspect, and every individual grieves differently. Um, and of course, there are two factors: instrumental grieving, problem, which focus on the problem, and of course, minimizing the emotional expression. And then there's the intuitive grieving, based on the highlighted emotional experience, and of course, sharing feelings, exploring, and even lost relationship, and considering mortality. Of course, there is the diagram stages of grieving by Kubler-Ross, Elizabeth Kubler-Ross, who was a medical doctor, and this talks about chapter on separation, anger, bargaining, depression, acceptance, and so there's the stages of grieving. Of course, Warden created the stage model um, of coping the death of a loved one and divided different process. And of course, there are four tasks: accepting the reality, work through the pain and grief, adjust to life without a disease, then of course maintaining connection and moving on with life. Of course, you have to help individuals deal with the grief and the loss, by accepting after the funeral. Of course, you can seek counseling, therapeutic role during burial rituals, crying being among them, accepting the pain. Don't force attunement. Acknowledge that people grieve and manage their loss differently. There are those who don't know how grief works. And of course, because of lack of knowledge, we get to educate. Of course, seek group or individual support. And of course, grief can. So remember to subscribe, and as we end our second domain and what it has been, second domain, so we are going to do a preview and see what we can do more. Thank you for making a difference and making it count, Kama. If you're not really happy with what I'm doing, please say, and if you are, comment down there and say what I'm doing is a